Okay, so with the scoliosis, first of all, it's important to have a view of the coronal views. The coronal views are views from the front, and sagittal is from the side. So what we see in the front view, actually the bending. And like here, you see the bending. This is in the front view, in a normal spine, it should go straight up and down. The bending in the sagittal view, side view is normal. But here, the bending is not normal. We call that bending Cobb angle, C-O-B-B. And the way to measure that, every program has it, that you go there, click on the measurement, C-O-B-B angle, and we usually then measure the bottom of the level that we are interested. Here we are going to do like L5, L1 to L5. So we are going to measure the L5 here. This is the L5. Cobb angle. That's one segment. The other segment is going to be 5, here's 4, 3, 2, 1. So the Cobb angle in the CT is 30 degree, and the scoliosis is to the right. The other word for the right is in Latin dexter, so we call it Dextro Scoliosis. If it would bend to other side, we would call it levo, L-E-V-O scoliosis, levo scoliosis. So this is a 30 degree Cobb angle dextro scoliosis. And if I ask you to measure the Cobb angle in different segments, you just have to go and measure it. Here is we measure from the bottom of the 1 to the bottom of the 4, for example. This is when they are laying down. When you get the upright images, like when they stand up, that always gets worse. Another thing that in a thing like that I will ask you eventually to measure is the torsion, which is many times even more important. The torsion means that if you look at the spine in the axial view up, this is like you're looking, patient is laying on the back, you're looking up. Head is that way, feet is toward us. And if we go here, you see that the back of the spine, the spinal process is not going exactly to the back. It's actually, there's a torsion. That's extremely important for placement of the screws as well as the cage. And the way to measure that, you can use as well, again, the Cobb angle to measure that. So you go from that divot here, you find that divot, which is easy to find here. You measure from here, straight down, one angle, and then from same place to the end of that, like here's 18 degree torsion, and the spinal process to the left. That changed a lot. That's extremely important information to how to angle the screw when we are putting the pedicle screw. And so obviously, the best is when you measure that where there is a pedicle, like here is the pedicle, then I may ask you how much is the torsion in L3, or for example, let's measure how bad is the torsion in L3. So first I put the sagittal here, I correlate them so I know where I am here. L3 is, pedicle is right, seems to be there. This is the pedicle of 5, 4, 3. So if I measure the torsion in the pedicle of the L3, go back.
Do you want
one going
2 8, or
down,
do you want 1 8 and then the radiograph?
one going down, about 20 degree torsion, and the spinal process is turning to the left. Okay, that's sort of most important thing for the scoliosis, to be able to measure the Cobb angle and the torsion, and what level we are going to measure. Thank you.